talk a little bit about kind of why IBS is my passion and a bit more about the plant-based side of things as well. And I'm going to talk about evidence-based strategies if you're a healthcare professional or if you suffer with IBS yourself. So hopefully it's going to be really useful and interesting for you, and I'm happy to take any questions at the end, so please go ahead and ask away. So a little bit about myself. There's me with the obligatory cup of tea that all dietitians have in our photographs. So I've been a registered dietitian since 2013. I graduated from KCL in London, and I worked initially in the NHS for 5 to 6 years, had a couple of children, and decided actually I wanted to go freelance. So I started up Green Health Dietetics in 2019. And I've been doing that ever since. So my focus is on gut health and specifically IBS, and both plant-based diets as well, and quite often together. So I have a lot of clients that have IBS and are plant-based, so whether that's kind of vegan or kind of vegetarian, so a combination of the two. And I'm really passionate about gut health. I've just always really found it fascinating, and I love how my advice can have such a big impact on somebody who's struggling with IBS, because it is such a debilitating condition. So that really gives me so much energy and drive to help people in that situation. And I've been plant-based myself really plant-based, fully plant-based for 2 years. And before that, I was vegetarian for almost 20 years. So I've really very much in the plant-based space as well, and really happy to support people on plant-based diets. That's really my passion. So I currently have 2 primary school age children, so kind of juggling that as well. I'm based in South London. So just a little bit there about me. My mission, so I help people with IBS to identify their food triggers quickly so that they can have the freedom to go out and socialise and be spontaneous without having to use the trial and error tactics and wasting time searching on the internet for answers or compromising on following a plant-based and plant-rich diet. So that really kind of summarises what I'm mostly about. So after the end of this webinar, hopefully you'll have a deeper understanding of IBS, about what the symptoms are, how it's diagnosed, and also the alternative diagnoses that are quite often sometimes missed actually. And I do get a lot of those people in my clinics who have been diagnosed with IBS and turns out it's something else. So we'll talk about that a little bit. I'm going to go through the evidence-based strategies for managing IBS, including the low FODMAP diet, in a little bit of detail, not loads. There's not enough time to do that, because it is rather complicated. And then I'm going to look at the challenges and kind of common misconceptions of managing IBS on a plant-based diet, and also kind of how to really overcome those. And at the end, I'll be talking about kind of a few free resources for you so that you can kind of go away and get a little bit of a plan going. So let's start off with, what is IBS? So it's a disorder of the gut-brain interaction, so one of many of those. And it's present in apparently around 4% of the global population around the world. And this is using the most recent criteria, so quite strict criteria. So thinking about kind of gastroenterology clinics, it's about 1/3 of presentations, so really quite a large chunk are IBS. We know it has a really big financial cost in England and across the world as well. So it's estimated that £72.3 million per annum is spent in England on managing, diagnosing, treating IBS, but also the loss of productivity that comes with it, because obviously if you're really kind of suffering and struggling with IBS, then you're not going to be able to work as much and as effectively. In Europe, it's estimated that £700 to €1,600 per annum is spent per patient on the management as well. So this, as you can see, this is really kind of has really large financial burdens as well. And like I've kind of touched on a couple of times, it has a really big impact on the individual's quality of life. So it really reduces the quality of life for some people, and to the point where they're thinking about it all the time, or perhaps they're out and about and always thinking about where's the nearest toilet, or to the point where even maybe they don't leave the house much as they'd like to, or book that holiday. So it really is a very important thing to look at, trying to improve where we can. So moving on then to the symptoms. So what does IBS look like? So the most common symptoms that we find are the abdominal pain, and actually you do need that abdominal pain for it to be diagnosed as IBS. You've got the abdominal bloating and distension, which is another really common one, and then the altered bowel habit. So whether that's diarrhea or constipation or a mixture of the two. Other symptoms that we often see are things like flatulence, incontinence, so mucus in stools, nausea, so backache as well, and fatigue. Fatigue is a really common one that I see in an awful lot of patients as well. So those are kind of, it gives you a bit of an outline. But what I would say is, everybody with IBS is very different. So one person has never got the same symptoms as the next person. So it really does show up very differently from person to person, and in terms of severity as well. Okay, so how does it look across the world? Let's have a look at that. So as I mentioned, the global prevalence is, well, 3.8%, so around 4%. It was previously 10.1. This is the kind of old criteria for diagnosis, and it's become a little bit more strict now. There are variations between countries, and we think this is probably influenced by things like the different foods that they eat, the culture, and different diagnostic practices as well. So this little chart shows you some of the prevalences that have been estimated across the world, across different countries, and we'll look a little bit more at ethnicity in a minute. And in terms of kind of the demographics, we tend to see IBS mostly in the well-educated, wealthy, also students, and tends to be younger people as well. And by younger people, I mean kind of, not older adults, essentially. So we're looking at kind of 50s and under. Western studies tend to show that there are more females with IBS, but actually in Eastern populations report less consistent gender differences. So that's not something that's seen so much over there. We can perhaps think about that a little bit later as well, why that might be. There does seem to be a really big common overlap with anxiety and depression, but also other DGBI, so disorders of the gut-brain interaction. And those are things like, what used to be known as functional diarrhea, functional constipation as well. So there are lots and lots of overlaps there. Thinking about ethnic differences then, so actually looking for studies was quite difficult to look at ethnic differences, because so many studies are just done in Western societies, and very few are done actually in different ethnicities. But I did find one that looked at it was a cross-sectional study looking at kind of IBS prevalence in 5,500 people from low and middle income countries. So thinking of Syria was one of the biggest ones. And they had a much higher prevalence of IBS than has typically been kind of measured. So up to kind of 25%, which is, really high. 1 in 4 people with IBS, really, really high. And they did look at the differences between ethnicities and found that actually Afro-Caribbeans had a higher prevalence compared to Caucasians, who had higher than Asians as well. So there's a little bit of evidence around kind of the differences in ethnicity, but really more studies need to be done in that area, because, as I said, so many of the studies are done in Western societies. And we think there's probably an environmental and genetic factor in those, and looking a little bit more detail in that. So there does seem to be genetic predispositions to IBS, so particular genes that are related to the gut-brain axis, which we know is what is really affecting in IBS, and things like gastrointestinal motility, and immune response as well. So all of those things also implicated in IBS. And perhaps the differences between ethnicities could be due to differences in gut microbiota as well, because we know again that there's a huge interplay between gut microbiota and IBS symptoms too. And that can be also affected by dietary intake, which obviously tends to vary between ethnicities and within countries as well. So there's another reason that we look at is this lactase persistence. So lactase is the enzyme needed to break down lactose from milk. So we know that after about the age of 5 years old, a lot of people actually don't tend to have that enzyme anymore. And this is really down-regulated. So lactose is one of a type of sugar that can cause symptoms in IBS, and particularly diarrhea predominant IBS. So we do see differences in across countries and between ethnicities in this particular area as well. In particular, kind of people from East Asia tend to be very not to have that enzyme anymore from quite a young age. For as little as 0% of people have it. So kind of that leads to a lot of people having this lactose intolerance as we know it. And then all the way up to kind of people of European descent, which may still have the lactase enzyme, up to 90% or so. So there's a big variation across the world in terms of this lactase enzyme persistence. So could this, explain a little bit of the ethnic differences? So now we're going to look at the causes. So what is the reason that people get IBS? So as you can see from this diagram, it mentions 9 different things that could, implicate in the causation of IBS. So you can imagine kind of when somebody goes to the doctor and says, why have I got IBS? It's really, really hard to actually say, which one of these things or what combination of these things is causing IBS. And actually, we don't really ever get to find out in a lot of cases, what is causing it. So, it can go from things like genetic factors can be involved. It could be to do with your gut, different gut bacteria that you have, or maybe some kind of dysmotility inside the gastrointestinal tract. Visceral hypersensitivity is a big factor in IBS as well, but whether that's the only cause, we don't know. And then the psychosocial factors, which are things like anxiety and stress, we know to have a really big interplay with IBS as well. But what we're going to be looking at is obviously kind of the food side of things today. And it's been found that kind of around 70% of IBS patients do report meal-related symptoms in response to at least one food. So you can see that this is, something that most of people with IBS are struggling with and suffering with, perhaps. So quite often, the food, changing food is something that's really, really helping people in terms of their IBS symptoms and management. So this is a very complicated slide. I won't read every single word on it, but it's really just about looking at the diagnosis. So how do we diagnose IBS? So when somebody turns up to clinic, or you turn up to clinic with the symptoms that we've discussed, with your symptoms, the GP should be looking at, is there a family history of celiac disease? Because we know that that's really common, and about 1% of people have celiac disease, so it's really important to check on that. Is there a family history of colorectal cancer or inflammatory bowel disease as well? Because these can all increase your risk of having these particular conditions, having a family history of that. So what the GP should be doing is looking at different lab tests to exclude other diagnoses in the first instance. So particularly looking at the full blood count, inflammatory markers, see if there's any inflammation going on, and then antibody testing for celiac disease. There's some quite specific recommendations from the NICE guidelines for the antibody testing for celiac disease as well, and that's really important to do. So what I would say is that is enough, actually, if all of those are normal, to diagnose IBS, as long as you meet the Rome 4 criteria, which we're going to have a look at in a minute. So there's really no need to send anybody who's got normal tests for these for any further tests like ultrasound or colonoscopies. So you can actually diagnose at this point. Obviously, if there's any of the red flags, you would then refer on to secondary care. So that might be to a gastroenterologist, for example, if we're seeing things like raised inflammatory markers for IBD, and signs and symptoms of cancer, for example, obviously you would refer on. So how do we actually diagnose IBS from the symptoms? So these are the Rome 4 criteria, and that's and these are people that set the criteria for lots of different functional gut type symptoms and disorders. So there needs to be abdominal pain present for at least once per week in the past. Oh, I can't see that, 3 months, I'm pretty sure it is. And associated with, because my face is in the way, associated with 2 or more of the following. So in association with opening your bowels, associated with a change in stool frequency. So that might be kind of opening your bowels multiple times a day, or, once a week, for example. And also associated with a change in stool consistency. So whether we're thinking about diarrhea or constipation. And the symptoms have to be there for at least 6 months before the diagnosis can be made as well. So there are classifications of IBS as well. So it's not just as straight as, IBS. There's 4 different types of IBS. So you may well have heard of these. So we've got IBS-C, which is constipation predominant IBS. And this is where kind of over 25% of the stools have to be type 1 or 2. And my lovely Bristol 2 chart, I love this chart. I use this all the time. I show it all my clients, and it can be quite a shock. It's very normal for me, but when I hold up to people, it can be a bit of a shock. But yeah, so we look at this and we use this to classify IBS into the different types. So if there's more than a quarter of the stools are type 1 or 2, which is, hard lumps or quite hard sausage shaped and really quite difficult to pass, sometimes with a bit of localized blood as well. And if less than 25% of the stools are type 6 and 7, so these are the kind of the very fluffy stools or liquid stools, then you can say this is an IBS-C. Diarrhea predominant IBS is where you get more than a quarter of the stools as type 6 and 7, and less than a quarter of the stools as type 1 and 2. And then some people have mixed IBS, where they don't really have predominant, they just have constipation and diarrhea over 25% of the time. And then you have non-specifics that are unclassified, where actually maybe they don't kind of fall into any of these other categories, and it's just a complete selection of any, or a normal stool, because people can still have normal stools and IBS. So what I would say is that it's very commonly underdiagnosed. There are quite a few different conditions that IBS is often mistaken, that are mistaken for IBS. So there's this really long list, obviously. So we're thinking about celiac disease. So it's really important to have that celiac screen. So definitely no self-diagnosis. If you do have symptoms, make sure you do go to your GP to get these tests and to get things like this excluded. But the most common ones that I kind of tend to see in my clinic after we've been through all the IBS advice, but the symptoms persist, are things like bile acid diarrhea. So up to 50% of patients with functional diarrhea or IBS actually have bile acid diarrhea, and that's a completely different diagnosis and different treatment as well. There's small intestinal bacterial overgrowth, which is really common too. So about a third of IBS people have actually got SIBO, and this is where you get an overgrowth of bacteria in the small intestine. So it can have really similar symptoms to IBS and also be improved by the IBS advice, but actually as soon as you start going back to more normal eating, which we would do in IBS ideally over time, then the symptoms just come straight back again. So and then they tend to also have symptoms with more kind of pure sugars as well. So things like just sugary foods as opposed to more of the kind of harder to digest carbohydrates, which we'll talk about in a little bit. And then there's a lot of confusion, obviously, often between people who have IBS and, whether their symptoms are more common premenstrually, or, perhaps it's endometriosis or PCOS. So the symptoms for IBS in these conditions can be very similar, and these diagnoses are often missed in IBS as well, because you kind of get a lot of that, particularly things like bloating, pain and diarrhea as well. So there is an increased risk in women as well, and that's related to sex hormones. Right, so moving on to dietary treatment, which is what I'm sure a lot of you want to hear about. So this quite complicated picture is from the British Dietetic Association guidelines for managing IBS. So I'll just briefly talk you through it, because I will talk in a little bit more detail on other slides about kind of what we do. But the first port of call is obviously to exclude other diagnoses like celiac disease, like I've mentioned about. And then what we would do if we have the diagnosis of IBS is that we would give healthy eating advice. So make sure that you're following a healthy eating and healthy lifestyle. Check for things like food intolerances like milk, lactose. So that's often one thing that is recommended first. So if you have IBS-D in particular, it's recommended to maybe try a lactose-free diet for 2 weeks and see if that helps, because a lot of people do have this lactase enzyme deficiency. And then you may look at things like dietary fiber, fluid, fatty foods, and spicy foods. We'll talk about this a little bit more as well. So this is the first line. We call it the first line advice. And so we recommend that clients or patients try this first. If you get an improvement, that's fantastic. You don't really need to make any more changes. But if there's no improvement, then we would go on to the second line advice, which is a low FODMAP diet. And I'll talk about that a little bit more as well. So first line advice, let's go through that in a little bit more detail. So it really depends on the individual. What I would say is I often just assess people in terms of what their symptoms are. I look at their food diaries and see, what are the things that are in their food diaries regularly? What can we change there if there's something that I can see that's really obvious that we might want to try? But generally speaking, the advice is around doing things like eating regularly, because we know that if you have large gaps between meals where you're not eating anything at all, so for example, if you have breakfast and dinner but no lunch, then that can exacerbate your symptoms. So when you do eventually eat after a very long period of not eating, this can really stimulate your gut. And that's called the gastrocolic reflex. So when you eat a meal, your gastrocolic reflex is stimulated, and it can just lead to you wanting to evacuate your bowels, essentially, is what it does. And this can be more exaggerated in IBS as well. So one of the advice is to kind of follow regular eating pattern. And that's the same as avoiding skipping meals, and also avoiding eating late at night, because we know that can exacerbate symptoms as well. So along the same lines, kind of some people find that eating smaller and more regular meals and snacks can be better for them, as opposed to having those 3 meals a day. You might want to try having 5 or 6 smaller meals or snacks. And that can be because some people with IBS have very kind of strong gastrocolic reflexes, where just kind of a normal size meal can really exacerbate their symptoms. So this is something that we can try. And it can also really help in things like the acid reflux and nausea side of things. So that can be something that I sometimes recommend for people with those types of symptoms. So I also recommend limiting or excluding alcohol entirely, because this can worsen symptoms too. And reduce caffeinated drinks, to often recommending no more than about 3 per day. But if somebody's very sensitive, or if they have a very strong coffee in the morning where gastrocolic reflex is stronger, then I would recommend, can we start cutting down on the caffeine and seeing if that helps? And that's particularly for diarrhea as well, because this tends to kind of cause people to want to open their bowels quite quickly after having a caffeinated drink. So fizzy drinks as well. So these can particularly worsen things like bloating and gas. So particularly if you're swallowing lots of gas, that's going to go into your gut and then cause more issues with wind later on. So that's something I recommend. And some fizzy drinks can also contain some polyols, which are difficult to digest as well. So that's another reason. We recommend drinking at least 8 cups of fluid per day. And that's for people with diarrhea and constipation, actually, and everybody. Because if you have diarrhea, then you definitely need to replace the fluid that's lost. And if you have constipation, drinking enough fluid is one of the main kind of reasons, or main ways to improve constipation. And not drinking enough is one of the main reasons, actually, that people do get constipation as well. So this is a really, really important one. I also recommend that people cut down on fatty foods if they're having those regularly, or for example, if you're going out to eat regularly, because foods in restaurants tend to be quite fatty. So this is something to look at, because fat can also stimulate the gut and cause it to work in inappropriate ways. Fruit is another thing that we think about. So fruit is very high in fructose. And if you have very large amounts of fructose in one go, which is in excess of the glucose content, then that can make your symptoms much worse as well. So with fruit, particularly with people that have got a lot of gas or bloating or diarrhea, then I recommend limiting fruit to 3 portions per day, and also trying to spread it out throughout the day as a first line. So you can see with this advice, this kind of first line healthy eating advice, and this can be done by most people, and it's always something to do with anybody, no matter what their symptoms are as well, to think about this type of advice, and before we even think about moving on to things like low FODMAP. So more specific advice, so looking at if people have diarrhea predominant IBS, we would look at trying to reduce the insoluble fiber. So insoluble fiber, we'll talk about where it is, but it's in kind of things like whole grain rice. And that's because too much of this insoluble fiber can just cause everything to go through you very, very quickly, so it can worsen diarrhea. Other foods that might worsen the diarrhea type symptoms are caffeine and alcohol, fizzy drinks, and sugar-free mints and gum as well. So these are specific things to look at in diarrhea. When it comes to bloating and wind being one of the worst symptoms, then we look at limiting gas-producing foods. Gas-producing foods tend to be things like, particular vegetables, like the brassicas. And then we also recommend eating high soluble fiber foods as well, which we'll talk about in a minute. And for constipation, it's actually quite different in a way. I see it quite differently. Maybe it doesn't seem too different, but so increasing soluble fiber again. So that's with supplements or high soluble fiber foods, and also just increasing all fiber, but more gradually. So being really careful about that. Because too quick an increase in fiber can worsen things like wind and bloating as well, and just be a bit of a shock to the stomach and the digestion. So when we say insoluble and soluble fiber, what do we mean? So I realised I didn't really explain what this insoluble fiber is. That fiber that that you get from plant foods that is impossible for us to digest, essentially. But I think we used to really think about it as roughage. So, but we know now that there's different types of fiber. Vaguely, there's lots of different types, but we can vaguely put them into these 2 categories of soluble and insoluble. What insoluble fibers do is basically add bulk to your stool. And when you've got diarrhea, you don't really want to do this, because we don't want more going through. So we look at reducing down things like wholemeal foods and high fiber flour and breads, reducing high bran cereal. So thinking about things like bran flakes, where maybe you think, okay, I need more fiber in my diet, I'm going to have more bran flakes, but actually this can worsen symptoms. Whole grains, like I mentioned about brown rice as well. And soluble fiber foods. So what is soluble fiber? It's something that draws water into the stool to make it softer. And this is really what we want in for everybody, ideally, apart from those which have got diarrhea. But particularly if you've got constipation, then having more soluble fiber foods can really, really help in this situation. So soluble fiber is from mainly things like oats and linseeds. Linseeds are fantastic. Something that I often recommend, particularly to my vegan clients, because they've got so many other health benefits as well. And these are ground linseeds that I'd recommend, but do it kind of slowly. So starting at a teaspoon per day and increasing up to 2 tablespoons over 2 or 3 weeks or so. You can also use psyllium husk, which is something you can buy in the shops and online, and that is purely soluble fibre. So it's a little bit higher in soluble fibre than the linseeds. Linseeds have got some insoluble in too, but they do a very similar thing. Or you can even use a supplement like ispagula husk, for example. A little bit more information about gas-producing foods. So, and we'll talk more about this later as well. Legumes like beans and pulses can be very gas-producing, which is a shame, isn't it, for vegans? So I can talk later about, how to overcome that and what to do to get around it. And the really well-known vegetables like Brussels sprouts and cauliflower as well can cause lots of gas to be produced. And then you've got things like the sugar-free mints and chewing gum as well. So always ask about, I always ask about the chewing gum as well. Right, so I just thought I'd put a little bit of information about probiotics because I know that it's a really hot topic and lots of people will want to know more about probiotics and how to use them in IBS. What I would say is I don't often recommend probiotics as a first line because really we want to kind of get the symptoms improving straight away and we want to get to the bottom of what the triggers are for clients. So I always recommend doing the food related changes first. And then once we've got to a nice level with the symptoms, then I might recommend, that they could try some probiotics. But really what we don't want is to do too many different things and in one go, so that otherwise we don't know really what's helped. So this is something that I might recommend later on after doing a few changes to the diet. So there has been loads and loads of studies looking at probiotics, but the problem with this is that there are so many different types of probiotics. Everybody's got different gut bacteria. So, one probiotic is not going to work the same for, somebody for two different people, essentially. But there is a little bit of evidence, and this is kind of more about guiding you towards which one to use if you do decide to use a probiotic. So some have been found to improve overall symptoms. Particularly Escherichia strains have got some moderate evidence for improving symptoms, and then there's the lactobacillus strains like Lactobacillus plantarum and some other combination probiotics have got a little bit of evidence for benefit in overall effectiveness. And if we're thinking about specific symptoms, so abdominal pain, there's a little bit of evidence for Saccharomyces cerevisiae and Bifidobacterium strains. And for bloating, there's a very little bit of evidence for combination probiotics and also bacillus strains. So you're looking at the really kind of lactobacillus, bacillus, and Saccharomyces bifidobacterium. And in terms of specific subtypes of IBS, in IBS-D, some combination probiotics and lactobacillus strains have been shown to be beneficial, some improvement. But in IBS-D, unfortunately, there's no benefits have been found that have been significant for any particular bacteria probiotic. So unfortunately in IBS-C, that's something that may not help, but it's worth a go because actually probiotics have been found to be really safe with no adverse events. So if you do want to try it, it's perfectly safe to do that, but really there's no point in continuing if you've done it for a month and there's no improvement. What I usually recommend is try it for those 4 weeks. If you don't see any change in your symptoms, then swap to a different one and see how that goes, because it may be that one, again, works for you. A particular one doesn't work for you, whereas another one will. So it's really just trial and error with probiotics at the moment. All of these studies have got so many differences in between them. So there's loads of, heterogeneity in between them. And then there's also the fact that there are a lot of very small study sizes as well. So we can't really draw too much from these, but I think we can use the studies to guide us towards where to start off with. And ultimately, we need the larger, well-designed trials with the standardized endpoints. Okay, so moving on to FODMAPs, finally. Right, low FODMAP diet. Oh, sorry, I've realised I've been talking already for 35 minutes. Oh my goodness. Right, so I'll try and get all this done. So what are FODMAPs? So FODMAPs is the second line approach to managing IBS. So it stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. And ultimately, you don't need to remember that at all. Don't worry, just call it FODMAP. It is they're short chain carbohydrates, and they're not very well digested. So they go through our gut unabsorbed and indigestible. And what they do is, because they can't be digested, they actually draw water into the small bowel, and that can cause diarrhea. And then once they get to the large bowel, then they're fermented by the bacteria in the colon. So you can see that there's all these different effects that can happen. And this ultimately leads to the bloating, the distension, the pain, the wind, and the diarrhea, and in some people, constipation, actually. So what are these different types of FODMAPs? So if we think about them one by one, so the oligosaccharides, they include fructans and galacto-oligosaccharides. So these are in things like wheat, legumes and beans, other beans, fruits and veg like onion and garlic. And then monosaccharides include are the fructose, essentially. So fructose is present in lots of different fruits, but particularly in some more than others. So like apples and pears, for example. It's also the main sugar in honey, and obviously in high fructose corn syrup as well. Disaccharides we think of is really just lactose. So obviously on a vegan diet, this is something that we don't need to worry about. But if you're a vegetarian or otherwise, then sometimes the lactose can be a really big trigger for symptoms. And like I was saying earlier, and particularly diarrhea, but it can cause constipation in some people as well. And then you've got the polyols, which are mannitol and sorbitol, and these are found in various fruits and vegetables like mushrooms and stone fruits, and also some artificial sweeteners. So how does the low FODMAP diet work? We have 3 phases. The phase 1 is restricting all FODMAPs, and it's really it is strict. And there are quite a few foods that you can't have, but there are also lots of foods that you can have. And a lot of the time, what I'm doing with my clients is expanding the list of foods they're having, because they've just excluded so many and too many, more than is necessary, because they're just trying to find an answer, which is completely normal and to be expected. So I would recommend restricting FODMAPs for about 4 weeks, and it may be enough. And if it is, that's great. And we'd move on to phase 2. But if, the client feels that they're still improving and they want a little bit longer, then that's fine. But what we don't want is to stay on low FODMAP for too long. And I'll talk about why. I better go a bit faster than I am. And then phase 2 is about reintroducing FODMAPs. So we look at reintroducing them one group at a time, or in the case of fructans, we have to do it one fructan food at a time. But it takes about 3 months, I would say, to introduce all of the foods back in again. And then phase 3 is looking at, okay, what can you tolerate and what can't you tolerate? And let's set up, a long-term plan for you so that you can having as much variety as you can in your diet as possible. Because we do know that you can have quite a restriction with a low FODMAP diet. And if you're not careful, you can be at risk of things like vitamin and mineral deficiencies. So I'll just go quickly through this, and really just to say that low FODMAP diet has been found to be effective for symptom relief in about 70% of people. So, compared to a normal diet, so really high amount. 7 out of 10 people have found relief from this diet. So it's very, very effective. And I found the same in clinic as well. So more evidence there that low FODMAP diet is the best for improving abdominal pain severity, bloating, and bowel habits. And quite a few studies often say, we do get better outcomes from a dietitian with low FODMAP training. So if you do want to do low FODMAP, then it really is advised to do this alongside a dietitian who's got the training. And in terms of IBS and plant-based diets, so where's the link there? We know about 10% of the world are vegetarian or vegan, but actually a few studies are looking at IBS in plant-based diets, unfortunately. So we really, would benefit from more studies in that area. There's a bit of evidence to show that vegetarian diets have been found to be associated with an increased risk in IBS. But is that because, people have cut out certain foods to improve their IBS, or is it the other way around? So we don't know what the cause and effect in this situation is. So it's certainly no proof that that's the case. Vegetarian diet liking was found to be protective against IBS. So that's in a genome-wide study. So that's quite an interesting one. But yeah, really, we do need some more studies looking at this area. In terms of plant-based low FODMAP diets, so there are some benefits in that, we're already avoiding dairy and honey. So we've got the lactose and the fructose sorted. So it can be a little bit of a faster process. Some negative effects are that there's a higher FODMAP intake generally from things like legumes and some fruits and vegetables if you have a high intake of fruit and veg. And also higher intakes of some complex carbohydrates and insoluble fiber, which again can worsen symptoms in some people. So we do need to consider the diets of people on plant-based diets and low FODMAP diet quite carefully to make sure that we're minimizing symptoms, but also ensuring nutritional adequacy. And for that reason, the low FODMAP diet is not recommended long-term, because we know that actually people on a plant-based diet can be slightly at increased risk of nutritional deficiencies. So how do we get enough protein on a low FODMAP diet with a plant-based diet? So when we're not having the legumes, so you can get your protein from things like tofu and tempeh, edamame beans, and you can have beans and pulses in smaller amounts, so it's still possible. You can have things like corn as well, and then nuts and seed butters. Nuts and seeds, obviously, a little bit soy yogurt, so not too much because that can be quite high in galactooligosaccharides in larger amounts. You can still have your nutritional yeast and spirulina. And there's some particular kind of protein powders that you can use as well if you are concerned. So there are still quite a few things that you can have. And I wouldn't say that this is particularly restrictive at all, because you're still able to have some of the smaller portions of beans and pulses and things like that. So a little bit about IBS and micronutrient deficiencies as well. So it has been found that people with IBS actually tend to have lower intakes of particular micronutrients compared to healthy controls. And that's more pronounced if they follow a low FODMAP diet as well. And the particular vitamins and minerals of concern were vitamin D, calcium, iron, zinc, and the B vitamins. And we know that in vegetarian and vegan diets, there is slightly higher risk for certain deficiencies like B12 and iron. So this is certainly something that we need to think about. And when you're combining it with a low FODMAP diet, this could be more, at risk. So you definitely need some proper dietary management to, manage long term. Right. So looking at this, this is a bit of an overwhelming slide when I'm trying to kind of get to the end. Let's have a look. So they assessed the nutritional adequacy of 105 IBS patients, and it was found that, yes, low intake of micronutrients was associated with more severe symptoms. So we definitely need to consider this to make sure that we're improving symptoms alongside having enough vitamins and minerals. And there are some particular vitamins and minerals that are found to be associated with things like fatigue, general gastrointestinal symptoms. So thinking about things like calcium, iron, and zinc, and all of these. And it was more likely that vegetarians were having these micronutrient deficiencies, particularly iron and ferritin. Unfortunately, vegans were excluded in this study. So another reason, we do need more studies looking into vegans and IBS, I think. Some examples for you of some nutrients and examples of low FODMAP dietary sources of those. So if you are considering doing a low FODMAP diet, it's a good idea to perhaps have a look back at this slide and really kind of make sure you're having all those things in your diet to make sure you're minimizing your risk of nutritional deficiencies. But ultimately, it's a good idea to have a supplement and containing at least B12, iodine, selenium, zinc, and vitamin D. And interestingly enough, there's been a few studies linking vitamin D supplements with improvements in IBS symptoms. So I'd say vitamin D is the minimum I would recommend that you take, absolutely. But if you can get a multivitamin containing all of those, then that's much better. So if you do want to kind of still have the things like the beans and certain fruit and veg which are high in FODMAPs, you can improve their digestibility and reduce the FODMAP content by doing things like pickling. So you can see that pickles, let's see, artichoke as an example, really, really reduce the FODMAP content. Canning and straining, so if you use canned beans and strain them and rinse them really well, then that can really reduce the FODMAP content as well. If you sprout things as well, so for example, the red kidney beans which were sprouted, they significantly reduce, so almost half the level of FODMAPs in there. So if you can sprout some of your beans, and that can improve then your FODMAP intake, or reduce the FODMAP intake, which means that you can have a little bit more, for example, sprinkled on your salad, which is a really nice way to have those. You can try activating nuts, so kind of soaking them in salty water for, I think, up to 24 hours and letting them dry, or kind of drying them on a low setting in the oven. And you can do extended cooking, so cooking legumes really, really well and draining the water off to take the FODMAPs away. That can help improve or reduce the FODMAP content as well. So summary, here we are. On a plant-based low FODMAP diet, so combining the low FODMAP diet with other restrictions like being vegetarian or vegan, plant-based, can be challenging because often the dietary restrictions are competing with each other in terms of kind of reducing what you're able to eat. And as long as you're having a variety of plant-based foods and your energy requirements are met, then you can have enough nutrients on a plant-based diet, obviously, and that's particularly with low FODMAP diet as well. So it is perfectly possible to do it. You just have to have a little bit more care around that. And really, we want to focus on making sure that you're getting enough of the protein, iron, zinc, calcium, and vitamin D if you do want to follow a low FODMAP diet when you're plant-based. So a couple of resources that you can look at. So these are on the Plant-Based Health Professionals fact sheets area. So you've got the first line dietary recommendations in IBS, and then you've got the low FODMAP diet for IBS plant-based. So those are really good starting points. But I would say if you do want to do low FODMAP, actually, if you can do that with a registered dietitian, that is going to probably be more effective. And if you wanted a bit more support from me, you can have a look at my free download. So 10 plant-based tips to stop IBS, bloat and pain. The link's there, or you can look on my website, greenhealthdietetics.com, or you can join my Facebook group, so Vegetarians and Vegans with IBS. So you can have a look at that. And let's see, there we are. There's my contact details, so please do get in touch if you want to. You can follow me on Instagram, or you can send me an email if you've got any questions. Okay, that's me.
Fantastic. Thank you so much.
You're welcome.
Stop sharing. So we're both
Stop sharing. There we go. Thanks. I didn't know you wanted to mute it.
It was so fantastic. Thank you so much, Lizzie. I learned so much. I'm sure everyone who's listening did. And we've already got so many questions coming in. So let's kick off by, I would love to find out from you, why IBS? There are so many different areas of dietetics. Why are you so passionate about this area and gastrointestinal issues?
So it's a question I've asked myself quite a few times, and I think I've always had this interest, ever since I was studying to be a dietitian at uni. It just really grabbed me, and what I really love about it, I think, is the problem-solving aspect in a way of it. So I've got a bit of a background of, I did physics initially at university, and then I went back to train again, so as a dietitian. So I have this kind of problem-solving, I guess, ability, and that really kind of, I just loved how, we look at a problem for a client and you can kind of work out what their triggers are and how they can improve their life. And that just seems to kind of fit really nicely with what I'm good at and what I like to do.
I love that. Thank you. And so someone's asked there's so many questions about the low FODMAP diet. In your experience, is there any benefit to be gained from partially following a low FODMAP diet? And this person said, I can't imagine following one 100%, even for 4 weeks with work and social commitments, and clearly following it and being fully plant-based is a little bit more challenging. What are your thoughts on that? Is a partial approach something that could be helpful?
Absolutely. Yeah. So this is something that I do use with my clients sometimes. So people who feel that, just like you, can't kind of face the idea of doing it for 4 weeks. So what we would do is look at the food diary in detail, and I'd ask them, I always ask my clients to fill in a food diary with symptoms, okay, so that I can see where the symptoms are happening and if I can see any potential triggers. So if I do notice by looking at that, maybe I think, okay, this person's having lots of beans and pastas, for example, let's par that back and see if that improves symptoms enough, because sometimes all people need is just an improvement to a certain degree in their symptoms. Other people want, complete, no symptoms anymore, and sometimes that is possible. Sometimes we can be still behind, but yes, absolutely, a different way. Sometimes that works really well. Other times it can mean that it just is a bit of a longer process because you're doing more of kind of a trial and error approach. But with vegan diets, actually, it can be a really good way to do things, because what we don't want is to go too restricted and increase the risk of those nutritional deficiencies too far. But yes, absolutely, that can work.
That's really helpful to know, actually. And so someone has asked, do you find individual patients are generally intolerant of one of the particular groups, such as oligosaccharides or disaccharides, or does it tend to be a bit of everything? What is more?
Really good question. Yeah, and it's rarely one thing, I would say. Yeah, it's quite often 2 or 3 things to different levels. Some people can tolerate, for example, absolutely no beans, but they have a bit of a problem with some of the high fructan fruit and veg, for example, and other people have got a bit of an intolerance to everything. And it's just about figuring out for everybody, every individual, where their tolerance levels lie. And it is different. I've never come across one person that's the same, unfortunately, and that's why we have to go through this process so often. Yeah, so it really is very, very individual.
That's really helpful. Is there a way to reduce the effects of problematic foods that cause IBS by cooking methods?
Mm.
You did mention some that some techniques could be used. Is there anything specifically with cooking that you would recommend?
So yes, so cooking in water and getting rid of the water. So not steaming. So rather than steam, I would say boil and then get rid of the water, and use kind of water-based methods as opposed to things like baking and frying, where you're going to be able to get rid of the FODMAPs that have leached out. So that'd probably be my biggest recommendation.
And I think, even things like obviously with, as you mentioned, with canned beans and chickpeas, then maybe boiling them again and getting rid of some of the water and really rinsing them
Yeah,
for a few minutes.
yeah, yeah, definitely. Yeah, exactly. As much processing as you can do as you can, yeah, as possible.
Does fermenting reduce FODMAPs? So if you're having things like kimchi and things as opposed to just plain cabbage, would that reduce the FODMAP content?
Fermented foods are really good for our gut health. So we know that that's for sure. And including them in your diet regularly can be really, really helpful. So that might be kind of more long-term, really, improvements in gut health and symptoms. But there is some evidence to show that fermenting can actually increase, and it depends on what the fermented is. So, for example, if it's a fermented fruit, that can actually turn the fructose into another FODMAP as well. So you can change the FODMAP. So it could be that you're more sensitive to the FODMAP that it becomes. So it can, for some people, worsen the symptoms. So, for example, if you've got some fermented fruit, the fructose might swap to mannitol. So it could be that if you're sensitive to that, then that's going to be a big problem for you. But so it really depends on the individual symptoms. So yeah, the FODMAPs will change, but in a sometimes a bit of an unpredictable way, it seems. So it's really about kind of trial and error for the individual to see if that fermented food is better for them than the original food.
That's a really good advice. Thank you for that. So many questions coming in, and I love this one because comes up all the time. Someone's asked about intermittent fasting in a bit more detail. What are your thoughts on that? So at least 12 hours, no feeding window to 16 hours. This in conjunction with 3 meals a day. What are your thoughts? There are so many different. I mean, intermittent fasting is such a broad term, isn't it? It's also
Yeah.
incorrectly. What are your thoughts about the ideal feeding window, or
Mm.
you see where often people are missing breakfast and they're having quite long fasting periods?
Yeah, I mean, so evidence to show that for general health, fasting can be quite beneficial, and that's for things like gut bacteria as well, as kind of things like blood glucose levels too. But in IBS, I'm not aware of any studies actually that have looked at intermittent fasting in IBS, but I am aware of ones that have looked at kind of, meal regularity. So having large gaps, like I was talking about earlier. And it may be that you'd be more prone to having a very large first meal if you had that really big gap. So that would be my concern, is that you hadn't eaten since the night before and you were eating first time at 12 or 1 o'clock. Would that meal be very large, and would that then trigger a lot of symptoms as a result through the gastrocolic reflex? So I would say, probably with that, it would be a bit of trial and error for the individual, because again, everyone's different in terms of how they react. But if you were going to do that, try it with, maybe I'd recommend probably maybe a snack kind of late morning, and then followed by a meal if you were going to try it. But if it works for you, then that's great, because some people do find that their symptoms are much worse in the morning, because that the gastrocolic reflex is very much stronger in the morning. So if you are having kind of really severe symptoms after your first meal of the day and it's early on, then maybe delaying that meal to a bit later could actually help you. So it really is about kind of trial and error. But I would say, it's worth a go for sure if your symptoms particularly are worse in the morning.
And I suppose some things which we know from so many studies is to leave a little bit of a gap between dinner and going to sleep, like letting enough time for that rest and digest process rather than sort of
Mm.
just before you go to bed. That's probably not really going to help anyone.
Yeah, absolutely. Yeah, because if you're going to bed with a really full stomach, you're going to feel quite uncomfortable. You might not digest that very well. It could lead to worse symptoms like reflux as well. So that's something definitely to be aware of, and just kind of have that little gap. And yeah, evidence does show that, let's try not to eat, after 9 o'clock if possible, for general health too. So that's kind of just good advice in general.
Thank you. Lots of questions about stress. Any advice for patients when symptoms flare up due to stress? Do you have any thoughts on that?
Yes. So this is really common. actually. So stress, anxiety can really trigger symptoms, quite severely in some people. So in terms of my advice, I would say actually let's have a look at maybe an app that's helping you with gut-directed hypnotherapy, so something like Nerva, because there's lots of evidence behind that. So if stress is a really big trigger for you, then it's maybe it might be worth looking at something like that meditation side of things, kind of CBT side of things, so cognitive behavioral therapy as well as gut-directed hypnotherapy. So trying maybe a few different things out to see what helps you, because yes, stress can be a really, really big trigger for IBS, and it can cause a big flare up where actually then symptoms are even more triggered by foods as well. So it's still really, really useful to know which foods you can and can't tolerate, but it may be that you can tolerate those foods even less during a stress-related flare up.
Yeah, that makes a lot of sense. Someone said, so how important though is stress management for managing IBS? Is in the context of everything, we've discussed a lot about nutrition, and we know that things like walks and things like that can help, but what is the role of stress? How would you weight it versus the other pillars of lifestyle?
That's really hard to answer, actually. I don't know I don't know kind of any numbers related to that. How important is it? I mean, I'd say it's very important. I don't know kind of what percentage, for example, but a lot of my clients are generally a little bit more anxious, and do find that kind of they're a little bit more stressed and notice that. But everybody noticed, a worsening. I would say probably everyone notices that their symptoms worsen when they're feeling more stressed. If you just think about, if you do anything that's causing you anxiety, like, a big presentation, or if you've got an exam, then a lot of people will get those types of symptoms. But whether that's not enough to diagnose IBS, obviously, but if you have IBS, then for sure symptoms are going to be a lot worse during stress. But I don't know actually. We do know that apparently females are more likely to have stress-related IBS compared to males. So there is that link that I know about. But in terms of how important it is, I would have to go and look that up.
And someone's asked about whether exercise can help IBS. I think we have plenty of data on.
Absolutely, yeah, for sure. And that's all types of IBS. So that's not just constipation predominant, where exercise is a really big important factor when it comes to kind of moving the bowels along. Even in diarrhea predominant IBS, then exercise has been found to be really, really helpful. And whether that's related to, your gut, or if it's related to actually reducing stress, we're not sure, but there definitely is very clear that that does help.
And for everyone who is around on the 22nd of October, I've just posted the link to our upcoming webinar on stress management with a health psychologist. And they're going to be discussing CBT techniques, and she actually specializes a lot in IBS. And as you said, there is particular forms of exercise that have been shown to be incredibly helpful. So yoga for the mind, body.
Yoga, absolutely, yeah.
Walking as well. It's such a helpful way to digest your food, and something that's really accessible, and you don't need a lot of training you don't need any training to start walking. So it's something that we'll definitely explore. I can see lots of passion for kind of discussing the different forms of exercise. Perhaps that's something we can do in the future. And how well can the low FODMAP diet approaches be done without dietetic support, which can be difficult to access on the NHS? What are your thoughts on that?
Yeah. So you can do it on your own. Yeah, so there's a really, really good app by the developers of the low FODMAP diet called the Monash app. Okay, so it's a Monash low FODMAP app, I think, and it's got all of the foods listed there that you would need to, and they're different FODMAP levels. So you can use that, and people do use that to kind of to check what foods they're having, what's high and low in FODMAPs. So that's a really, really good place to start if you really wanted to do that. And if you wanted to, what I would recommend is to sit down and just maybe plan kind of maybe 3 or 4 days, or even the week of low FODMAP meals, kind of check what you're having already and just make some swaps to make it as easy as possible, and then just do that kind of weekly meal plan every week to make sure that you are staying low FODMAP. And then they also support you in terms of kind of reintroduction as well, so it can be done. Yes, but evidence shows that it is, more effective with trained dietitians. But my concern with that would be that, what would push people to start doing the reintroduction? Some people might end up doing low FODMAP for a very long time, and as we know, that can be negative, have a negative effects in terms of their nutrient intakes. But yes, you can do. You can have a low FODMAP. The Monash app is very, very good, and it's got all the updated foods. I check it all the time.
That's really helpful. I have the app as well. I've just quickly launched a poll to get everyone's feedback, which is great. Thank you for answering. I just have a couple more questions to whiz through because I think they're really
Mm.
good. Is there a FODMAP test that can be done, or is it only while trying that you find out that the low FODMAP diet can help you? Is it kind of by trial and error?
Yeah, unfortunately, there's no test. How brilliant would it be if there was? And I think, the management would be very, very different if there was a test. But it really is about trial and error. And that's the best way we have at the moment. Who knows, in future there might be a test. There are some tests to look at different aspects of, things like SIBO, but obviously that's a separate issue entirely. But no, we can't. It's about, cutting it out, seeing what the effect is, how your symptoms are, and then bringing it back in to see, just one thing at a time directly, what happens when you have that food. And that's the way we test it.
Perfect. I have just mentioned it's called the Nerva app, Nerva. You can look at it on the App Store. We're not affiliated with it in any way, just so.
Nice. No, I'm
Um,
not. I don't get no, I don't get any affiliate income from that. It's the only one. It is I think they work closely with Monash as well, so it's a very good one.
Wonderful. Is low FODMAP diets, are they also advised in inflammatory bowel disease? So things like Crohn's and ulcerative colitis, is that stuff that's recommended?
Yeah, there's more and more studies coming out showing an improvement in symptoms in IBD with the low FODMAP diet. So that is something, although it's not used as a first line, it is something that some people do benefit from. Definitely, and I have used it in my IBD clients as well in the past.
Makes a lot of sense.
Mm.
Are there any tips for eating out as a vegan on a low FODMAP diet to avoid
Mm.
most eateries?
Yeah, I mean, I think the important things are to, if you can find out in advance, look at the menu in advance and pick those things out. Definitely asking them to do swaps for you. So, for example, asking, have you got onions and garlic in this meal, for example, or can you give me a meal without onions and garlic? Can you make it slightly differently? Asian food tends to work quite well, particularly because you can get a load of tofu and stir-fried vegetables. You can ask for other swaps as well. So, for example, instead of if you're getting a burger, you might say no bun, but give me chips instead. Chips, the everlasting vegan best friend. So things like that. So I'd say a bit of planning, asking for swaps, and trying to plan, and look at ingredients in advance if you can.
There are good resources online. Obviously, things like inulin has become quite a popular thing to sneak into foods.
Mm,
And kind of just watch out for those things that can be added to sauces as thickeners and other things like that. And I
yeah.
another top tip is to go to places where you can build your own bowl, like poke bowl places or salad bar places where you could select, tofu, you can select sweet potato, you can select the low FODMAP ingredients and use a simple miso dressing rather than using something which has got unknown things. So I think those can be quite helpful if you're at
Mm,
lunch or somewhere else, but definitely places where they cook from scratch, it's going to be safe,
yeah.
and in places where that they're friendly. And I think some of the bigger chains, they probably have, if you look it up, you probably can find all kinds of information about places like Wagamama and
Oh, absolutely. They definitely have to have their ingredients, shown.
Um,
Mm.
and okay, so I think that wraps up everything. We've really got to most of the questions, and there were some that were repeated. Some of the information was already in your wonderful slides showing that, if you're on a plant-based diet, sometimes you might have more symptoms, especially if you're first making those changes. But overall, it can be a really effective tool to improve gut health and manage IBS, and you can totally customize it, and you can try a low FODMAP diet if you are vegan, and we've got really good resources online. You've got that brilliant handout which I signed up for as well, so do go and check out Lizzie's website, Green Health Dietetics, and follow her on social media, keep updated with all her work. And please remember, none of what we've been saying is, do always consult your medical doctor. The low FODMAP diet does need to be supervised by a dietitian, so just be aware of that. Is there anything else you'd like to add, Lizzie? Anything to kind of remind everyone who's listening?
No, I think that's everything. Just I'm happy to, answer any emails if you've got any questions. Just send one along or hit me up in a Facebook group or something like that. Happy to support. But thanks everyone. It's been a really, really fun, and really hope you found it really useful.
Thank you. I'm sure they did, because it was fantastic. And just to say to everyone as well, if you would like to see future webinars about IBS and other lifestyle medicine areas, then let me know. you can send me an email, you can pop it in the PBHP members group. So that would be really nice to hear if that's something that you're keen to hear about, and you should receive all the details and slides and everything in a few weeks' time. So we'll see you at the next webinar soon. And thanks again, Lizzie. Good night, everyone. Lovely.
Thanks. Good night.